Good morning to our Caring for the Mind, Body and Soul focused Optimal Aging Conference attendees. Hope you have enjoyed the conference this far. What a day we had yesterday, opening the conference with a powerful message from Dr. Sunderman about movement, receiving an update from Alzheimer's about Alzheimer's disease and other related dementias, and closing the day with Dr. Williams, helping us to understand the importance of nutrition, health equity, and cardiovascular health. I'm sure you enjoyed the networking opportunities and breakout sessions as well. Before we jump into day 2 of our conference, I want to remind you that you do not need to wait a year to continue your education and commitment to the best practices and policies related to optimal aging. All you have to do is join the UofL Traeger Institute once a month for our Project Echo on the care of older adults. Project Echo is a tele-mentoring platform that brings together a group of interdisciplinary healthcare professionals, social service providers, and students to learn about state-of-the-art practices that help our patients, clients, community members, and us optimally age. During these Project Echoes, we continue to focus on the 6 pillars of lifestyle medicine, as well as other important topics related to the care of older adults. Our next Project Echo is scheduled to occur this week, Friday, April 21st at noon. The topic is Reframing Brain Health, Using Lifestyle Medicine to Improve Cognitive Functioning, featuring our own Dr. Sam Cotton from the UofL Traeger Institute. We begin each session with a didactic, then one of our partners presents a complicated case in which all the person's biological, psychological, and social aspects of health are discussed. And we work together in a transdisciplinary space to consider ways for this person to optimally age within the context of what matters most to this person. Then we ponder how we can take what we learn to our communities in our Kentucky Coalition for Healthy Communities discussion directly after the Project Echo. Remember, it does not matter where you live because Project Echo is virtual. We would love for you to be a part of this learning community. If you are interested, please email me or anyone at the Institute and we will take care of you. Now, it's time to welcome our special guests. First, we will hear from Dr. Crystal Collins Camargo, the Interim Dean for the Kent School of Social Work. After that, Alicia Johnson will give a message. She is from BRAD. She's the AAA Director, and she's also the K4A Chair. She will provide a welcome, and then you will hear from Barbara Gordon, who will introduce our keynote presenters for this general session and will also moderate this session via an interview. Thank you. Enjoy the session.
Hello, I'm Crystal Collins Camargo, Interim Dean of the Kent School of Social Work and Family Science. The Kent School is very proud to be a part of the 7th Annual Optimal Aging Conference. The Traeger Institute is led by 2 of our outstanding faculty, Drs. Anna Fall and Pam Yankee Love, and many of our graduates and devoted community partners work at the Institute. I know it's going to be a wonderful opportunity to be inspired and impacted regarding ways that innovation and integration can enhance the aging experience. Caring for the mind, body, and soul is a theme that resonates with all of us and is critical across the lifespan. In these next few days, you will be provided with the opportunity to learn from professionals and older adults on a wide range of topics designed to enhance the health and well-being of our community. Enjoy the conference, and thank you for stepping up to promote optimal aging in our community.
Good morning. My name is Alicia Johnson, and I'm the Associate Director of Aging Services at BRAD, which is the Barren River Area Development District. I'm also currently serving as the K4A Chair, which is the Kentucky Association for Area Agencies on Aging. The AAA network has a variety of programs that we offer seniors and disabled individuals to help them stay in their homes and communities. We appreciate our partnership with the Traeger Institute for Optimal Aging Clinic and the work that they do. Conferences like these help us forge new partnerships, learn about resources in our community, and can help us grow professionally. We hope you enjoy the rest of the conference. Thank you so much.
Good morning, everyone. Welcome to our Optimal Aging Conference. My name is Barbara Gordon. I'm the Director of Community Engagement at the Traeger Institute. It is my pleasure to introduce two of my longtime friends and keynoters for this morning's session, Sandy Markwood and Bob Blancato. I'm going to give you a quick bio for each of them as we introduce them to you this morning. Sandy Markwood is a national advocate for aging issues and a champion for ensuring that people have the best supports to age well at home and in their communities. As the CEO of U.S. Aging since 2002, she is committed to ensuring that as a society, we value and support people across the lifespan. That commitment has taken many forms, including advocacy with multiple administrations, and on Capitol Hill for the passage of legislation aimed at supporting older adults, including access to critical information, in-home services, and caregiver support. A passionate advocate, Sandy and U.S. Aging have launched campaigns focused on promoting healthy aging, combating social isolation of older adults, preventing elder abuse, ensuring that older adults have access to new transportation and housing options as we age, among others. Her goal and the goal of U.S. Aging is to ensure that we all have the ability to age with good health, independence, and quality of life we all deserve. Aging isn't just about adding years to our lives, it's about adding life to those years. Good morning, Sandy. Welcome.
Nice to be with you, Barbara.
Yes, so happy to see you. Now, let me introduce to you another friend of mine, Bob Blancato. Robert Bob Blancato is the Executive Director of the National Association of Nutrition and Aging Services Programs. He is also President of Mott, Blancato and Associates, the National Coordinator of the bipartisan 3,000-member Elder Justice Coalition, and the National Coordinator of the Defeat Malnutrition Today Coalition. Bob has long been recognized as a national advocate with policy expertise on behalf of older adults. In 2019, he was invited by both the Senate Finance Committee and House Ways and Means Committee to testify on a range of issues. Bob's prior work history includes 17 years as a staffer in Congress and an appointment by President Clinton to be the executive director of the 1995 White House Conference on Aging, one of 4 he has participated in. He is a member of the Senior Executive Service. As a volunteer, he currently serves on the National Board of AARP and the board of the National Hispanic Council on Aging. In 2019, Bob began a 4-year term on the National Advisory Committee on Rural Health and Human Services, appointed by the HHS Secretary Czar. Bob holds a BA from Georgetown University and an MPA from the American University. He's won numerous awards for advocacy, most recently, the American Society for Aging's ASA Hall of Fame Award, awarded in April of 2021. Good morning, Bob.
Good morning, Barbara. Thank you for that nice introduction.
Yes. So we're excited to have both of you with us today. As you probably noted from my reading of their bios, and I'm talking to the audience this morning, between the two of them, we have several decades of knowledge and experience in advocating and lobbying for legislation and policies that facilitate optimal aging for everyone. The question is, how can we influence policies that will support the care of mind, body, and soul of each of us across the lifespan? And Bob and Sandy, that's where I want to start this morning. The first question for you, as we have this conversation about policies and how they can influence the care of the mind, body, and soul across the lifespan, in what ways has or can public policy enhance the aging experience? And we'll start with you, Bob.
Oh, I was going to ask. Okay, thank you, Barbara. First of all, thank you for this wonderful invitation. Thank you for the work you've done in the aging field and before and now. Thanks to Dr. Fall. It's nice to see her again. Thanks to all the people who put this event together. I'm delighted to be with my colleague and friend Sandy Markwood to talk today and And wearing my ARP board hat, I want to do a shout out to Ron Bridges, my good friend, who's a state director in Kentucky. He's a great leader himself. So, government, public policy has enhanced the aging experience over time. I mean, the origins of Social Security and Medicare and Medicaid and the Older Americans Act were envisioned an aging society. They were envisioned that we were going to be having demographic changes they had to go through. And I think what we have to look at now is reevaluate the premises of some of these programs from this vantage point. The role of government has always been key, but the role of government has to maintain the strongest commitment to help those in need and the vulnerable of all ages. Okay, we shouldn't be talking about slashing safety net programs in this economic time that we're in. We need to be focusing on all aspects: economic, health security, personal security, things like preventing elder abuse. But I think really what we have to go is public policy can enhance the aging experience by looking at programs through an intergenerational lens. Okay, I mean, Social Security, it's fine to protect current beneficiaries, but we have to look to the future. The younger generation expects Social Security. They've contributed to it. They expect it to be there. We need to look at Medicare, continue our focus on prevention, which we started back when the boomers started turning 65. With Medicaid, we need stronger home and community-based care funding, which is the preference of older adults and their families. And of course, and we'll talk about the Older Americans Act, I know, later. Key part of its mission has always been to promote the independence, dignity of older adults, which is part of the aging experience. So I think we have been there before, but we have a way to go as we go into the future.
Thank you, Bob. Sandy?
Well, I think Bob really hit on it. And when you look at public policy is our national statement. It's not just, it's our national statement to this nation, but it's also echoed throughout the world on what we believe, what we value as a nation, and what we're willing to invest in. And that's the basis of public policy. And when you look at that in terms of aging, as Bob said, there was a commitment made in 1965 to Medicare, to Medicaid, and the Older Americans Act, which was signed before Medicare and Medicaid. But that was really our national commitment to ensuring that people in this country can age well, can age with optimal health. And I truly want to commend the Traeger Institute and for the work that you're doing to really hold up and support optimal health and the work that you've done throughout your career, Barbara, that really reflects that. But public policy is a foundation for that. And so as advocates, and everybody that is listening right now is an aging advocate, needs to get engaged and follow public policy because that reflects our beliefs. And it also reflects what this nation invests in. And when we're looking at the demographic change, we need to invest in ensuring that older adults can live well at home and in the community. As Bob said, there's an intergenerational component to this too, because when we look at aging, we reflect the fact that people age from the time that they're born. So we can't just differentiate and say, well, this group goes to kids and this group goes to middle-aged individuals and this group goes to older adults, when what we do across that lifespan impacts what happens in the life course. Additionally, we seem to compartmentalize on a public policy basis healthcare and social services. But we know, you all know, that, and now research shows with the social determinants of health, that really we need to take a much more holistic view from a public policy perspective on how to support optimal aging. So I'm encouraged, but I'm really encouraged to be on this platform with so many aging advocates that can help amplify this message moving forward.
Thank you. So that really leads perfectly into my next question. You talked about, both you, Bob and Sandy, about really this redefinition of aging, not just looking at aging from the perspective of 60 and older, 65 and older, et cetera, but across the lifespan, really redefining what it means to age and to age well, understanding that there are many things that impact how we age. So we are redefining what it means to age. What do you think? How is public policy supporting this redefinition? How can public policy support this redefinition?
Well, I guess you want me to go first again.
Thank
So
you.
I think, it's a redefinition to some extent, but I think it's always been about aging well is about being all you can be, okay, and having the opportunities to do that and to be well, okay? Aging well with economic security, with work opportunities, having enough savings, aging well with health security, focus on prevention, screenings, and so on. But public policy can always do more in this space. We for people who are suffering from age discrimination, they're not aging well. They're missing the opportunity to strengthen their lives. For those, we should be spending more on mentoring. We should be spending more public policy should be focusing on mentoring relationships between the older and younger individuals. Each can learn from the other. Mentoring is just not a one-way street. Mentoring can be both ways, and we should be thinking about that in that context. Same way with lifelong learning. Okay, I mean, I know that at your school they focus on that, and that's very important because education should be throughout the lifespan. Okay, and I also think that we need to do more in the elder justice space. Okay, for every victim of elder abuse in this country, they are not aging well, and they will never age well. And we have got to make a stronger commitment as a nation to combat this one evil that continues to impact 1 out of every 10 older adults in this country. And so, we just need to examine where we're not aging well and concentrate more resources there, but also strengthen those programs where we are contributing to aging well.
Well, I would just jump in building on that, Bob, is that when you're looking at taking that holistic approach, and one of the things I love, so many things I love about U.S. aging, but one is our vision statement, which is to value and support people as they age. And when you're looking at that, oftentimes we look at one side of that equation or the other. We're either valuing people or we're looking solely at a support. And recognizing that throughout life, it's both. And both need to come together. So in looking at aging and public policy, again, we tend to silo it. So there's Medicaid, Medicare, and then there's the Older Americans Act. But what I'm beginning to see, and I give Allison Barkoff, the current acting assistant secretary on aging, administrator of ACL, the Administration for Community Living, a great deal of credit, because what she's doing is she's going into other federal agencies, whether it be the Centers for Medicare and Medicaid Services, the Housing and Urban Development, Transportation, and inserting aging into their agenda as well. And I think that's that holistic framework, whether it happens at the national government level, federal government level, the state level, but it should also happen at the local government level, that when we're looking at the policies that are implemented at all levels of government, that one of the thoughts that should go through all policymakers' minds at all levels of government is, how will this impact people over their lifespan? And that will be a determinant of really being able to value and support people as they age.
Thank you. Yes, as you all were speaking about that, and particularly what you said, Sandy, about how aging needs to be integrated in all policies at some level, in some way. I totally agree with that. I work in an academic institution, for example, and I believe that every discipline should have a focus on aging, because again, it's not just about one particular population group. It's about all of us because we age across the lifespan. And that brings me to my next question about the Older Americans Act. It amazes me even today, and I've been working in the field for a very long time, that so many people who even work in the field of aging are not aware of the Older Americans Act. And you mentioned earlier, Sandy, that it was first authorized in 1965, right? So it's been around for a very long time, and it's probably one the more progressive public policies that have impacted our country and our communities over all of these decades. And we've talked about for many years modernizing the Older Americans Act. Talk to us a little bit, and I'll start with you this time, Sandy, about the Older Americans Act and the programs that are included in the Act. Over time, how can that Act become more holistic, maybe even integrating across all of these other programs and services at the federal level, definitely impacting us here in our local level? For example, how does the Older American Act itself support a person's health of mind, body, and spirit? How does it do it now? How do we need to continue to work towards modernizing it to be more effective in this particular area?
Oh, well, happy to jump in on this one, Barbara. I really think the Older Americans Act is a beautiful piece of legislation. Again, it's the national commitment to people to be able to age well at home and in the community. That being said, since it was enacted in 1965, every reauthorization it gets added to. And those additions really reflect the needs of older adults at the time. So the nutrition program was added. Bob, and you were critical in adding, elder justice provisions into the act and looking at growing the act to meet the needs of people. When we're looking at your question about mind, body, and spirit, there are elements of that in the act now. When we're looking, but they can be amplified and they can be enhanced. And there's a reauthorization in 2024. So will be the time to have these discussions. But looking at the support for evidence-based health promotion and disease prevention programs, which is included in Title 3D of the Act. But it needs to grow and it needs to be invested in. That it's not only putting things in the Act, but it's getting the funding to really realize their potential. I think another element which you all at the Traeger Institute have really focused on, and I think we can amplify, is brain health and recognizing that what is included in the Older Americans Act and what is in the realm of both area agencies on aging and providers is not only nutrition and physical activity, but all of those combined to improving brain health. And the other element that I'd say, especially since COVID is top of mind, is social isolation. And again, the Act has always dealt with and promoted social engagement. But I think now we realize we need to do that more than ever, that really combating social isolation is a core service of the Older Americans Act, or certainly should be. So I think that we can build on all of those elements. But I also say it's not just what's in the Act, it's how funding is appropriated to really realize what's in that Act and to be able to ensure that all of those elements can be delivered at the local level and reach everybody who needs them.
Thank you. Bob?
Well, of course, I agree with my friend who knows the Older Americans Act as well as anybody in the country. And but I'm going to go back and say, the Older Americans Act, when it was created, it's Title I of the Older Americans Act. The original thing is the National Statement of Aging Policy that talks about the holistic approach to how you should be providing services, whether it's housing or transportation. And it's taken a while for Title I to be implemented throughout the rest of the titles of the Act, the other 6 titles in the Act. And I think, the goal was always about maintaining the independence and dignity of older adults. That is as holistic a statement as you can have, frankly. You have targeting in the Older Americans Act, which itself is holistic in the sense that you are reaching the people in the greatest economic or social need, but with particular attention to a whole range of other individuals. And we need to add, by the way, LGBTQ to that list as we go through the reauthorization. The problem, I think, sometimes is we have a siloing of the individual services and the programs. Okay. And I think the way the Older Americans Act can better support mind, body, and spirit is to focus on the outcomes of the different interventions on mind, body, and spirit. Okay. These services exist for a reason. People need the services. They're improved as a result of the services. And that's really what you should be looking at, how you measure the effectiveness of a program. And also, to go to Sandy's point, the more you show from a data perspective, an evaluation perspective, the better your chances are of getting more resources, okay? Because, one of the things that we've been frustrated at for years, and I think it was in the last Older Americans Act, but it hasn't been really pursued the way it should be. How much does the Older Americans Act save Medicare and Medicaid each year?
Mhm.
And if we got a number like that and plot back even a percentage of that into the Older Americans Act, we would see our funding grow dramatically. So I think the Older Americans Act is a very good example of how you approach aging policy from a holistic standpoint, and we can do better, and we will do better because Sandy and I are going to make sure it happens.
Great. Yes, I love the Older Americans Act, and I definitely share that with you all in the importance of it. And before we move on to just another set of questions, you said quite a bit in terms of what's going on with the Older Americans Act currently and what is going to happen next year in terms of this reauthorization. Talk to us a little bit about, how can we impact change with the Older Americans Act? What can we do to help advocate for this modernization, for, the changes that needed, and especially, as you indicated, Sandy, the funds that are needed to support the things that it is proposing to do for older adults in the communities?
Well, let me start by saying, before we get to reauthorization, we got to get through the fiscal year 24 funding.
Mm-hmm.
Okay? And we need everybody involved in this one because, we're coming out of the pandemic. As you know, a number of programs in the Older Americans Act received significant funding during the pandemic because they delivered important services during a time when people were scrambling without a playbook to get things done in a pandemic. And they did a marvelous job throughout the Aging Network. Some of that funding needs to continue, obviously. You may not get as much as there was in there, but it needs to continue. And you need to see, the president has put out a budget proposal, and he gives important increases to Title IIIB, to the nutrition program, to the Native American programs. But there's some talk up here, and we have to be very careful about this conversation. It's very current. And that is, we have to raise the debt ceiling. Okay, there's going to be a vote on that as early as June. Okay, the president has said it should be a clean bill, keep everything out of it, just raise the debt ceiling and deal with other issues later. On the Republican side, on the House side, they want to tie spending cuts and other things to raising the debt ceiling. I think as a community, as advocates, we can't afford a rollback of funding to fiscal year 22 levels. It will decimate and devastate programs across the country. It'll cause loss of millions of meals and other services across the country. So I think what I would want people to do is support a clean debt ceiling bill and get the spending issue off the table. And then we focus on what funding levels we should see. And I think the president's budget provides a good framework for us to support.
Well, and following up on that, Bob, you're absolutely right, as always, in that, the issue is not having the aging programs, Older Americans Act programs, going back to a level that would completely decimate service delivery at the local level. When we at US Aging did a survey last year, and it hasn't changed, what we found is that 94% of AAAs were serving more people than they did before the pandemic. And the people who came to them during the pandemic were not leaving. And that 95% of the AAAs said that the clients they were serving had more complex needs than they did before the pandemic. So the fact that the COVID funding is going away or is gone, we're going to be left with more people to serve in greater need, and really turning back the tide of funding to pre-pandemic levels will decimate so many lives who really depend on these programs to do what the Older Americans Act set out to do, was to ensure that people could live well at home and in the community. You have to be advocates on appropriations. But there's another upcoming opportunity to weigh in, which is, it is our understanding that the Administration for Community Living is going to come out with regulations on the Older Americans Act sometime this summer. There hasn't been regulations on the act for 30 years. So that is an opportunity. There will be a public comment period on that. Look for those, because that is an opportunity to really weigh in on how these programs are delivered at the local level. So most important is getting the funding, but also look at the regulations when they come out, and please comment on those. They'll be out for probably 60 days. On and give your thoughts on how these programs should be implemented.
And let me just add one more thing, Barbara, if I could, from an advocacy standpoint. Both Leader McConnell and Congressman Rogers are on the Appropriations Committee from Kentucky. Okay, they focus on making what those numbers turn out to be at the end of the year. So I would concentrate efforts on those two individuals in terms of supporting adequate funding for aging programs.
Right. And advocacy can occur in a number of ways, including writing letters, phone calls, et cetera. And they receive emails as well. So definitely, we'll probably resound on that message before we conclude today. We all need to advocate. And thank you all for reminding us of that. I want to talk a little bit about Title III-E of the Older Americans Act, National Family Caregiver Program. So last year, the National Strategy on Family Caregiving was released. And we know that Title III-E is part of the National Older Americans Act, and that program is very, very important. As it relates to this strategy, the National Strategy on Family Caregiving, where do you see that going? And what do we need to do as a nation to support our caregivers, to support their mind, body, and spirit? Caregivers are in significant need every day. We serve caregivers here at the Traeger Institute, and would love to just hear a little bit more from you in terms of, what direction is that going?
Well, first of all, it's almost a disgrace how little we support family caregivers. Mm-hmm. You mentioned the National Family Caregiver Support Program. Pretty much that's it. Mm-hmm. At the federal level, $200 million or a little less for the whole country at a time when family caregiving has grown exponentially. So yes, the National Strategy on Family Caregiving is very important, but I think the issue there is there's almost too much in that report. There's 350 some odd recommendations. We've got to figure out as a caregiving advocacy community, what are the most important things? And in my judgment, there's only one really important thing that we've got to advocate for, and that is a family caregiver tax credit. Okay, we've not been there. We've come close. We've had it discussed. There is no reason why in the next time we have a tax reform discussion in Washington, which could be this year, could be next year, we should have that front and center before anything else, because it's the one thing that can reach more people, frankly, than any other tax reform I can think of. Because if there's 44 million people, families with caregiving responsibility in this country, that's a huge number of people. I also think that as we continue to fund disease work, whether it's in Alzheimer's or other programs, we should be earmarking portions of those money for caregivers. Mm-hmm. Okay? Because every disease has somebody who's caring for somebody with that disease. And we forget that piece of the puzzle. And I'd like to see, especially in the Alzheimer's space, because it's so important to have a strong family caregiver structure for those suffering from Alzheimer's and related dementias. But we don't see the resources trickling down from that pot of money, the research pot of money. And I think you could do that very easily and make a very strong case for that.
Yeah, I agree, Bob. I think I really think caregiving is one of the highest critical, national issues right now. Whether you throw out the figure 46, where it's 53 million people caring or family caregivers, that's a huge amount. And again, you're right, with the National Family Caregiver Support Program and its funding level, we can't even touch most of the caregivers that really need education, support, respite care. And we really need to invest in caregivers. I think the tax credit is a wonderful way to do it, but I also think that we need to increase funding for the National Family Caregiver Support Program. And also, you mentioned about the disease specific, ensuring in research that you also include caregivers. I would also say that we need in the healthcare arena to recognize caregivers and support caregivers. One, we need to recognize them when they bring a care recipient in, but also support them and their health, because what we know is that oftentimes it's when the caregiver their health falls apart. That's when the person that they're caring for ends up in a dire health emergency or often institutionalized for a period of time. So we need to really strengthen in caregiving, and I would say across the board, a stronger bridge between what happens in the acute care health world and what happens where most health happens and services and support, which is at home and in the community. But also there's an opportunity with the implementation of RAISE. There is an initiative called Act on RAISE that US Aging is pleased to be a part of, which is looking at all of the recommendations, the 350, but looking at how to prioritize those so that they're actionable. And so I would encourage people to look that up. It's called Act on RAISE.
Great, thank you. And there's a really good question in the chat that I want to just share with you all and ask you. I think this is a really good time to respond to this question. It says, this is from Roland Tarter. It says, it's hard to believe that conventional advocacy efforts can have impact in this political divided society. How can you help us renew our faith in the advocacy process?
Well, I'll start with that one. I mean, first of all, I want to disavow any notion that advocacy is not important. Advocacy is very important these days. How you do it is, you know what? You talked about it before. People galvanize around a particular issue. Your job is to educate and inform, okay, people about the impact of policy that they could be supporting or they should be opposing, depending on the circumstances, what it may be. There isn't an issue I can think of that you can't impact if you know how to localize and humanize that issue. Okay. At the end of the day, that's what it's about. When you're dealing with elected officials, okay, in the Congress of the United States, it's more important in some ways for them to hear a message of advocacy on a particular issue at home, okay, at the Rotary Club, or wherever they may go around in their districts, than it is in Washington. Okay, they can hear from Sandy and I anytime we want, but when that same message resonates back at home, it takes on a different meaning. It takes on a different consequence. So you take an Older Americans Act, you localize and humanize it by the work of the AAA in that area, the work of the nutrition program in that area, the work of adult protective services in that area, and talk about how continued funding is important for these services to continue. So you have the knowledge, and you should not be viewing what goes on up here as a deterrent to doing advocacy, because what goes on, this is a cocoon up here, okay? This DC is a whole different deal, okay? Because they all have to go home, okay? That's part of the deal. And they're spending more time, by the way, they're spending more time at home now in the Congress than they've ever had before. And advocates should take advantage of that opportunity at every opportunity that there is.
Absolutely. And I think the thing is that it boils down to, if you have data, great, but stories, it's their neighbors, it's people in the community. Those stories, and you all have them, are powerful. So, and also just recognizing that not only members of Congress and their staffs, which are really important, are people, and they need to hear from you. And you should feel really that you can reach out to them at any time. And if you're having events in your community, invite them. They want to come. They want that photo opportunity. But most importantly, they really do want to hear from you. So that's the key in advocacy, is step up, step out, tell your stories. And it's saying that what Bob also said, because some people go, well, we can't lobby. You're not lobbying, you're educating, you're increasing their awareness, you're helping them do their job better.
Thank you.
If you have a voice, use it. Okay, that's the key piece of advocacy. If you have a voice, use it. If you care enough, use it.
Great, thanks. So my next question is, in 2035, not too far from today, there will be more older adults in the U.S. than children under 18. As we look at this demographic shift, is increased longevity a positive or negative for our nation? How does this shift in demographics impact the workforce?
Wow, that is a big question. And in some ways, looking at that statistic, I think it really, is amazing for all of us. I mean, we know about the demographic change, but really recognizing the fact that there'll be more older adults than children under 18. But that goes to something that Bob said earlier, which is intergenerational. It's not recognizing that we are all one people. We age over a lifespan, and being able to look at ways to bring young people and older adults together, recognizing both can mentor. Young can mentor on technology. Older adults have lifespan issues that they can translate to a younger generation. When we're looking at that longevity issue, I think the one thing is what we're seeing is more older adults wanting to be and being in the workforce, and how to support that. And that will go to another issue that I hope we'll discuss, which is ageism. But also looking at how we can support a sense of community that brings generations together instead of separates them. And what we found even in communities, in university communities, when they build new housing that is really supposed to be targeted to students, well, what they found is there's a lot of older adults who want to downsize and get into that housing too. So starting to look more holistically across generations, I think, is going to be really important. The other issue I just have to put on the table, and it makes people feel uncomfortable, is when we're looking at longevity too, is we need to have a real serious discussion in this country about end of life issues. And what it really is, what we really want as a society, individuals and families at the end of life, at the end of that longevity, because oftentimes that's something that is skirted under the table and ends up being a major crisis issue for families.
Is increased longevity a positive or negative? It should be a positive, beginning with the reality of why do we have increased longevity? Advances in medicine, value of good lifestyle decisions being made at early. It's positive that the value of the people as they age is recognized through adequate employment and training opportunities and other ways to contribute. As long as that is the focus, that's a positive. But, we have to be realistic. Not everybody's enjoying the same level of longevity. I was appalled near the end of the midterm campaign when it was proposed that the retirement age under Social Security should be raised to 70. Okay? Minority older adults don't live as long as non-minority older adults. You are disenfranchising and discriminating against millions of people by having a proposal like that on the table. And that, and the advocates are talking about everybody's living longer in this country. Well, not everybody is, and not everybody's living well. And I think, when we talk about the workforce, it's interesting. When Social Security was started, there were 5 contributors to every beneficiary in the system. Okay, now we're down to less than almost 2 to 1. And so there's a compelling need for the older adult to be in the workforce, to strengthen the workforce. But the problem is we've got to still fight against age discrimination. It's still the 3rd highest complaint registered in the Equal Employment Opportunity Commission each year. And it has to do not so much with lack of opportunity, but lack of ability to grow within a position. Proper training, retraining, things of that nature. There is a tendency to avoid the older worker in that setting. Okay, we have to do everything we can to strengthen the workforce that includes the older adult, given the same opportunities of people who are younger.
Thanks. And speaking of the workforce, we are all aware, all of us, of the crises that we're experiencing in the workforce. And it's not just individuals who are working, for pay or a salary. It's even volunteers. Since the pandemic, I was talking to a colleague not too long ago, and they were talking to me about their volunteer recruitment campaign and how it has been significant struggle since the pandemic and building their volunteer base back up. Obviously, it was diminished as a result of the pandemic. So given all of these challenges that we're currently facing in the field, particularly as it relates to direct care workers, volunteers, and the aging field across the board, what needs to happen to respond to this challenge,
Right.
short-term and long-term?
Well, first of all, I'm very pleased to note that at about 2:00 today, the president is going to be announcing a major new executive order to strengthen the long-term care workforce and the child care workforce. Okay, I heard people to look at that when it happens. And about an hour and a half after that, Sandy and I will be joining some of our colleagues from the aging space at a Senate roundtable that Senator Sanders, the chairman of the Health Committee, is holding. And let's talk about bipartisanship for a second. Okay, his counterpart, Senator Cassidy from Louisiana, Republican, the first issue they decided to go out and get input about was workforce. They put out a request for information asking everybody to come and discuss what the workforce issues that they should be addressing in the Health, Education, Labor, and Pensions Committee. So it has now reached the point that the workforce is a legitimate policy and political issue. It has finally reached the point where it's impacting enough people's lives that something has to get done. And I guess the best example I can think of, and I think to me, if you just connect these two dots, it makes sense. Childcare is workforce. Workforce is childcare. Okay. And if we start making the connections about what workforce means to the lives of the economy, to people, I think we'll see significant progress made on the legislative front in that area this year.
No, I agree with you, Bob. I think in every survey we do in the Aging Network and across the board, workforce is a huge issue. Not only loss of staff, but Barbara, as you mentioned, it's loss of volunteers. So you've got the greatest need, and you've got a crumbling workforce. And I think that as we look at this, it's salaries, it's investing in these programs and the staff who are delivering them. It's looking at training, and for the direct care workers, it's looking at professionalizing a workforce that is not only heroic, but is doing some of the most important and intimate work in ensuring that people can stay safely at home. But it is an economic opportunity too, as we look at the drivers of change and the drivers of age. And, and looking at across the board at new solutions. For the first time last year, U.S. Aging actually took a policy position on immigration because of the need to expand the workforce. That's not an area that is really, in our bailiwick, but we recognize the importance of training technical assistants and salary increases, but also that immigration needed to play into it too. So we really need to look holistically. And as Bob said, this is a top of mind issue for Congress. It is also a bipartisan issue as well. There's an opportunity here to move it forward.
And if I could follow up just a little bit in the workforce space before we go forward, we know that in the direct care workforce area, that one of the biggest challenges that they've been faced with is pay. I worked in the area agency on the aging arena for many, many years, and that was an area that we tried to influence as best we could, but there are so many issues revolving around increasing the pay for direct care workers. There's still this mentality, socially, politically, et cetera, that doesn't allow that to happen readily in a very effective way. What are some things that you all have seen? Do you think that this roundtable discussion you're going to have later, or this executive order, is any of that going to influence increasing the pay for direct care workers?
The answer I would say would be yes. I think that when you talk about, even before you get to today's announcement and today's roundtable, the president in his budget last year and this year called for a major new investment in home and community-based care services under Medicaid of which a good portion of that was about raising the benefit levels and the pay levels of people working. I mean, we have an 800,000 person waiting list, give or take, in home and community service, partially because there aren't enough people in the workforce to address this growing need. But and I'm literally reading this.
It just came out.
Yeah, the fact sheet that I'm looking at here, and the president in this fact sheet says, you know, one of the goals is to boost job quality for early educators and long-term care people in the workforce. And so this is probably going to be, they're calling it the biggest initiative ever taken in the workforce space. It probably could very well be. And you have to understand, if it's an executive order, it doesn't require Congress taking action. Okay, Congress can enhance and improve, okay, what the president puts out, but the president needs to take the lead on this, and he is. And so they must have heard you're having this meeting today, because they just decided to make an action just in response to your concerns and issues.
Great.
Yeah, this is a very exciting announcement, and I think will pave the way for hopefully more actions. And look, what's important here is when the Build Back Better, the piece of legislation that Bob was referring to, it would have increased salaries for people who are working on Medicaid. But we need to do it across the board. It needs to be the staff of area agencies and other aging provider groups, as well as direct care workers. So we need to look at this holistically. But this is a great first step.
Great.
And I would also, Barbara, I would add, just reading again off the sheet on the family caregiver piece that we just talked about, to provide greater support to family caregivers, this executive order will direct HHS to consider testing a new dementia care model that will include support for respite care. Okay. And you know, that's an important connection to be made between the two. So this thing is pretty comprehensive. We're going to be all excited to read this in greater detail when we finish this session with you.
Great. So we didn't expect to get, this type of information hot off the press.
Hey, breaking news, right? There you go.
Right from the White House this morning.
Yes. Thank you for sharing that. And just a little tidbit, don't want to assume that our entire audience know how to access this type of information or to stay up to date. What are some of your suggestions for our audience to try to stay up to date with this type of information out of Washington? Sandy?
Well, we will be posting this information up on our website, and I'm sure Bobby will too. But as these things are evolving from the White House, the White House website is a good place to go. And once you sign up for things, they will send you things and keep you updated as well. So again, there is so much information out there, but what you want to do is to be able to distill it to the purposes that you're focused on. But there will be a lot of, after the president signs the executive order at 2:00-ish today, there will be a lot of information that will be hitting the papers and all of the aging organizations in this. And certainly you can go to the U.S. Aging website as well to get further details.
Great, thank you. We're going to be wrapping up in a little bit, but I do have a couple more questions that I want to ask you. And you've already hit on this a little bit. You mentioned that pretty ugly word, ageism. How does ageism, and it still exists in this country, it raises its ugly head often in many ways, in the workplace, but also in our communities and our media, and I can go on and on and on. How does ageism affect our ability to care for mind, body, and soul? And should combating ageism be a higher national priority? Can you give us some strategies even for advocating against ageism? Sandy?
Well, I would say that ageism, along with racism and ableism, these isms really just tear not only the fabric of society apart, it tears people's lives apart. It has negative impacts on people's ability to live well. It has a negative, and research has shown it, a negative impact on body, mind, and soul. In fact, there was a recent book out, Breaking the Age Code, how beliefs about aging determine how long you'll live and how well you'll live. So we know that ageism is a negative. How can we turn it around? Well, I think we need to have a commitment. I know that right now, in Hollywood, they're looking at how they portray older adults and how they script their discussions about aging. That's just one segment of society, but an important one for perceptions. But how do we individually take that on? How do we confront people with age discrimination or just ageist comments that sometimes you just let go by because they're funny? They're not funny. They really have negative impacts. And so we need to stand up as a society, and we need to ensure that in our the communications that we put out, and Reframing Aging is a wonderful resource. It is a national project that gives communication tools and tips on how to ensure that the communications you use as an organization or an individual that really don't have an ageist spin to it unintentionally. But I just think as a nation, this is an ism we need to take on.
And I totally agree. And I think the only thing I would add is that we've got to look at this, of all the isms that we talked about, the one that most people could be impacted by is ageism.
Right.
Okay. By a long shot. So whatever anger, whatever motivation, whatever advocacy was used to address earlier isms and to reduce them should be applied to ageism. And I think that it's not a hard stretch. It needs to start locally. You're right. You need to call it out where you see it. Okay. I mean, what's that old TSA saying? If you see something, say something. Well, it's the same thing with ageism. Okay. But you just have to be able to understand it and call it out and not take it as a given. That's the mistake that people make. You shouldn't take it as a given, because it's where the society has changed.
Okay, thank you. So we have two questions in the chat. I'm going to ask you these questions, and then when we wrap up, Dr. Fall will be before you to give you some more announcements. So Sandra McGuire asks, how are intergenerational opportunities addressed in the Older Americans Act? Sandy?
Well, in looking at the Older Americans Act, there are several places that talk about intergenerational programming, but I think, one of the other new initiatives that was launched by the Administration for Community Living is an intergenerational focused project, and also grandparents raising grandchildren as another initiative to be able to bring generations together and meet the needs of both. So there are Generations United, which is a national organization, an incredible organization. I know, Bob, you've been engaged with them, is a great place to go for resources, best practices programs on intergenerational issues, and also through the Grandparents Raising Grandchildren, there's also an innovations hub that we are also at US Aging helping to support for them.
Thank you. And Bob, I'm going to ask you this next question. What encouragement do you see for affordable housing for the elderly, for older adults?
More than ever, honestly, more than ever. Because like a lot of other things, it just took a while for it to resonate as an important component of successful aging or people aging well. And the more you see age-friendly communities, the more you see a focus on livable community, the more you see a focus on changing the dynamics of a community. Housing is at the center point. The more you talk about social determinants of health, which now obviously have gotten tremendous attention, housing's in the front and center of it. So, when housing was siloed, it didn't really work out real well. Now that it's part of a bigger conversation, a bigger picture, there's many, many opportunities for improvement. And I see a lot of things on the horizon. I see numbers in the president's budget that talked about expanded housing support for older adults. And I don't think of any aging organization I can think of that isn't focused on housing and wanting to improve our commitment to housing and improving the quality of housing.
Thank you. So Bob and Sandy, we do thank you both for being with us this morning. I believe we have all learned so much just from this conversation. I'm going to now turn it over to Dr. Aniki Fall, and she's going to conclude our session.
Thank you, Barbara.
Great, thank you.
Thank you, everyone. I hope you have enjoyed this session with Sandy and Bob, and thank you, Barbara, for facilitating a great session. Please remember to complete the survey after each session, especially if you need the CEU credits. You have been provided a personalized link that you will use throughout the conference to complete your evaluation for each session and the conference as a whole. Please also check your email. Also, the OAC session survey must be completed after each session, including the last session of each day, in order to earn your CEUs. Please do not forget to go to the exhibit hall to learn more about our sponsors and our exhibitors and thank them for their support. Also, you still have a chance to get all of your answers for the scavenger hunt submitted by the deadline, which is noon today. You don't want to miss out on an opportunity to win one of those prizes. There's still so much to check out, including networking opportunities. You can learn about many conference activities by checking our navigator bar in the conference foyer. This concludes our session, and we will start with the breakout sessions shortly.